Hi, my name is Kerri Gallagher, and today I'll be doing my health assessment vital signs video. But before this assessment, I washed my hands for 30 seconds or sang happy birthday to myself 2 times using hot water and soap. Today our patient will be Taylor Boza, who is here for a checkup. Okay. So, you're here for a checkup today?
Correct.
Nothing's bothering you other than that? Okay. Do you have any family history?
No, I do not.
Do you have a past medical history? Have you been hospitalized recently?
No.
On any medications?
Not currently.
No surgeries?
Nope.
Okay. All right. Well, if you could just take your shoes off and step on over here, and we'll do your height and weight.
Okay.
Okay. So you can step on the scale. 115. You can step off, turn around, put your feet all the way against the wall, stand up straight. 5'7". Okay. Okay. Next, I'm going to take your temperature.
Okay.
98.6, the golden standard. It's normally between 96.4 and 99.1 Fahrenheit, in case you're wondering. Okay, if I could just have your hand. I'm going to take your pulse using my index finger and my middle finger. I'm going to wrap it around your wrist. And I'm going to count for 30 seconds. Okay. I got 80, which is again the golden standard. It's normally between 60 and 100. So I took it for 30 seconds because your pulse was regular. It was a regular boom, boom, boom. That's the rhythm that it was. If it were irregular, such as, boom, 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 I would have taken it for a full minute.
Okay.
While I was doing that, I checked for the elasticity of your veins, and we like to see them to be spongy. We like to feel spongy because if they're hard, that means it's harder for the blood to get through. And the force of your veins, I would give it, or the force of your pulse, I would give it a nice 2+ because, like I said, it had a nice beat. If it were to feel thready, light, I couldn't really feel it, that would be a 1+. And if it was a 3+, it was bounding, very strong, it would be a 3+. Okay. And while I was doing that, I didn't want to tell you, but I was checking for your respirations. Normally, we don't like to tell patients previous to that because I don't want you to think about your breathing and change it up, and then you could, without knowing, you could change it. So I got 15 for that, which is normal. The normal range for respirations is between 10 and 20.
Okay.
Okay, and while I was doing that, I checked for symmetrical expansion, which is just your chest rose and fell. Normally, like it wasn't one side rising, the other side. Okay, and your position was well, you sat up straight, breathing fine. Normally, if you were hunched over, I would be concerned about COPD or some other respiratory infection that's causing you to change the way you breathe.
Okay.
Okay, so we're going to go on to blood pressure. Now, I'm using a regular adult-sized cuff for you because you're not a child, and your arms, you're not obese or anything. I don't need a larger cuff because if I were to grab the wrong cuff size, if it was to be too small, it could falsely elevate your blood pressure, and if it was too big, it could falsely lower it. Okay, so for the position, I just need you to uncross your legs, sit back straight, put your arm out, palm up, just relax it so it's elevated with your heart. And for this, I'm going to make sure that the line for the artery is lined up with your brachial artery. And I'm going to make sure that the Velcro is totally covered. So it's 80% around, 60% above your brachial artery. Okay. And your normal blood pressure?
I usually run like 120/80.
Okay, well, I'm just going to pump it up This is just going to be like a trial run so I know where to pump it up to. When I stop feeling your pulse, I'm going to release it, okay?
Okay.
So it might be a little tight. Okay. Just as you said, I stopped feeling it at about 120. So now I'm going to pump it up to 140 just so we can be sure.
Okay.
I'm going to use the diaphragm of my stethoscope to listen. Okay, 120/80, which is the golden standard. The first sound that I heard was the systolic. That's the rate at which how hard or forced the blood is coming out of the heart. And the diastolic, which is the 80. That is the rate at which the heart relaxes to open up and have the blood refill. Okay? Do you have any questions?
I don't believe so.
No?
No.
All right, well, thank you for coming in today.
Thank you very much.